Hi, it's Ariel. I'm just making a video about today, which was my VNS surgery day. Today, I just wanted to let you know what it would be like if you're looking at getting a VNS and what your day might be like. So it was an outpatient surgery, which means that I didn't stay in the hospital. So this morning at 2:30 we got up, and then at 3:30 we left, and at 5 we got down to the hospital here in Sacramento. So that was really early. And then went in, there was the registration, which I had already done online and with a nurse, but of course they had more mistakes to fix. Then the nurse took me back, and my partner Vanessa, she was able to come with me into what's called the ambulatory care unit. And so we went back there, and I got into a gown. They did a EKG, very simple, quick one. They did a urinalysis. They did a, blood pressure, that kind of stuff, normal, everyday medical stuff. And then she started the IV in me. And so took a couple times, but we got it. And then I was ready. So that was about 6:30. Then the anesthesiologist came around to my bed, and I was in a bed at this point, and Vanessa was able to still be there. And then the anesthesiologist came around. He talked to me. I was able to tell him that I tend to have anxiety last time I had surgery, I had pretty bad anxiety right before it. And I had really bad anxiety last night. I actually did quite well when we were waiting at the hospital and driving to the hospital. I think because we were going toward it and moving along. It was last night when I was trying to sleep that I had a lot of trouble. So anyway, then and if you can do anything that helps you, I was crocheting this morning, which I won't get to do for a little while now. Then we were still in the ambulatory care unit. Then after the anesthesiologist, the nurse came by, and that would be in the operating room with me. And she introduced herself and wrote down some notes, like Vanessa's phone number in case she wasn't in the waiting room for surgery for some reason. How to contact her, that kind of thing. So I got to talk to her, and then Dr. Sarasillo, who is my neurosurgeon, he came in and just very quickly said hello and, checked my charts and stuff. So after that, then Vanessa went back out to the surgery waiting room. Then I was wheeled up into the hallway, actually, where I was heading toward the surgery room, the OR, and then I was given something in my, some kind of, I think it was a relaxant, but anyway, I was out, right then. And so the next thing I knew, I woke up, and I was in the recovery room. And Vanessa was there. So I was very happy to find out that the person who's coming with you can be with you in the beginning while you're getting ready, and they don't have to wait out there for you. And my last surgery, I had shoulder surgery on this side, and nobody was with me. So it was just a lot harder, the getting ready. Then the actual surgery, you're out, so it's not that scary. And then when you get into the recovery room and you wake up, that can be really scary. So very soon after I woke up, Vanessa came in, and it was really nice to see her. And I was really groggy, to be expected. That was about 9:30 that I woke up. So, it took about an hour for the surgery. My doctor said about 45 minutes to an hour for the actual surgery. And I just wanted to show you where you actually get the cuts. So one obviously is right here on my neck. They slice it open, go in, wrap around the vagus nerve. After they have gone in right here, and I can't really move it, so I can only show you a little bit, but right here, they insert the stimulator behind your pectoralis muscle. So then they thread it up. Sorry, this is sideways on this thing. Anyway, they thread it up here and it goes around and then they close it up. I'm having a problem with my bandage. I may have to go back to the doctor's tomorrow morning. Some tips I think I would give to anyone who's having this surgery is do be prepared. You know, it took a lot of time this week. I had to get a physical. I had to, in the last couple of weeks, but it ended up being this week. The nurse calls you the day before and goes over all your health profile again before today, and then they do it again when you get in there today. So then also yesterday the registration called me, you know, so that was like half an hour each. Then, you know, getting enough sleep is really important. It's hard if you're having a really early morning one. Even if not, it was hard for me to sleep. And so, you know, some people it's hard to sleep. If you have anything to take for anxiety, do. The not eating was hard for me because I have low blood sugar a lot. So, and no drinking water for 8 hours before. So last night at like 9:30, I stopped drinking water and eating, and I was so thirsty this morning. When I got into the recovery room, they gave me some ice chips. They gave me an anti-nausea medication because I tend to get nauseous and vomit. And so you can get, you know, let them know that if you have that. Let them know that you have bad anxiety if you do. You don't have to just be anxious. They can actually put something in your IV line that does help with that. If you know your meds, if you've ever had surgery before, knowing what anesthesia worked for you before, then they don't have to just guess. That can be a good idea if something worked well. So if I have another surgery, I would try to find out what I had this time because it worked pretty well. Then I can't take a shower until, let's see, 1, 2, 3, 4, 5 days. I'll take a, you know, half shower, but I can't get the bandage wet and take it off until Monday. And so that, you know, depends on the person, the bandage, the doctor, that kind of thing. But in my case, it is going to be a few days. Nobody mentioned that. Also, I was curious about the recovery time. Everybody said, oh, it's not that long, or, you know, kind of vague. And I would say I will keep you updated as I recover. But I would say one thing that I did not anticipate is the pain in moving my arm. You know, I anticipated that this might be painful. And I was kind of thinking for some reason it was over here where the incision would be. But it's over here, and it's kind of to the side here. Let's see if I can get that kind of going to the side. And it hurts. And it's totally, you know, not that bad in terms of worth having surgery. But lifting, this is my other arm, you know, it's no big deal. Like lifting this arm, there it hurts. And I'm not supposed to lift it above here for a week at least. Maybe 2 weeks. Well, until it stops hurting. So anyway, that's just another thing. Even if my recovery, I mean, I'm doing pretty well. It's 8 p.m. and my surgery was at 7:30 a.m. and I'm awake, and you know, it only took me like an hour to wake up from the anesthesia. Then it was about an hour in the recovery room, and Vanessa was there with me, and I was just groggy and waking up. And then after a while, they discharged me. I'm trying to think if there's any other specifics. Well, just another thing that they tell you this, but I didn't, know it before. But don't put any lotion or anything on when you get out of the shower. And I would definitely recommend taking a shower the morning of the surgery, because you don't get to take a shower for a few days. So when you take a shower that morning, don't put any lotion, anything on. Take out all your jewelry. They ask you that kind of thing. Leave your stuff that you can at home. I gave it to Vanessa, my purse and stuff. But I would definitely recommend not having it with you. They just put it on the gurney with you, like your clothes. And so, it's not very secure. And I am really grateful. I had a great team of my neurosurgeon and, you know, everybody, the nurse, they were all really nice. And, you know, when they came and met me, and that always feels good going into it. You know, the other thing is that I'm having trouble with what I'm eating. Kind of hurts to swallow right now. This is day one. You know, I'm guessing it's going to get a lot better. But that wasn't something I really thought of either. And just the, you know, it's not super painful. It's just kind of hard to move. And same here. It's hard. It is painful more here, but it's hard to move. But every time I swallow, it's not super painful, but it's like it kind of irritates it. And I think that's just because, you know, the muscles here are so strong and your swallowing muscles up here, and, you know, it's all so close. And luckily, you know, they didn't slice into the muscle or anything on here. They just kind of slice open your neck and then get into the vagal nerve between your carotid and your jugular, and then wrap the lead around it. So, you know, it does have some healing to do. You do have a little battery pack about this big right here now, which I think I can feel it. I mean, I can actually touch, you know, it's not that painful. Well, it's more painful over here on the side where they actually did the incision, but, you know, I think that it's thicker or something. Anyway, it feels kind of weird. So, anyway, that's my day one of my VNS surgery, and they don't turn it on for 2 weeks. I have an appointment in like 13 days or something, and we'll have an update after that about the actual turning it on and what that feels like and my experience as I go along. You just have to rest a lot on that day. One thing I've realized by having 2 outpatient surgeries is that they kick you out and they shouldn't. You know, you should be resting all day in a bed. And it's just so hard to do when you get up and leave the hospital, to just not do anything and just lie there. And luckily I've done that most of the day, but there are things to do, you know, like eat food and whatever, you know, just simple things. But I do think that they just do it for money reasons. But I already think that about a lot of other surgeries that they do in like outpatient surgeries. My shoulder surgery was very similar in that I couldn't move it actually at all. And I had an ice machine on it, and I spent a week on the couch at my aunt's house, completely drugged with pain meds and totally non-functional, and had to have somebody care for me. So, you know, that's the hard thing about when they don't do an inpatient surgery, then you end up having to get a lot of care afterward. So I would recommend that if you can, have some people set up to come over and bring you food. You know, I'm sure somebody doesn't mind bringing one meal, you know. I have certain really big dietary restrictions because I have Lyme disease, so it's a little harder, but, you know, some people in my life have offered to come over even just to come and say hi, and, you know, if I need to stay at home. So I definitely think, you know, do plan for some recovery time. Also, don't plan work or school or doing anything really big or difficult like that for probably a week. I mean, I can tell this is not going to be really, really fast. And so really just give yourself some time, you know, give yourself the chance to heal. It's really important. And I think sometimes when you have an outpatient surgery, there's this idea that, oh, I'm not in the hospital anymore, I must be fine. So take care of yourself.